Right now we're talking to Premier Surgical Associates about a new way to perform gallbladder removals. There's a lot of colostomy removals happening, but right now they're talking about a new innovative way called the Bikini Cholecystectomy removal. So here to talk all about it right now is Dr. David Schutter. He's a general surgeon at Premier Surgical. So thanks so much for joining us today.
Yeah, thanks for having me.
Of course. So let's just go ahead and get it started. You know, why is gallbladder removal so common?
Well, honestly, there's just a lot of problems that can happen in the gallbladder. So in the United States, there's 700,000 cholecystectomies per year, which is just kind of wild to think about. But about 20% of the population is going to have some pathology with the gallbladder, and about 20% of that is going to have the gallbladder removed. So it's the most common thing that we as general surgeons take out. So just super common.
Right. And, you know, who really is most at risk if it is this common?
Yeah, so unfortunately, it's more common in the ladies. So we have about a 3-to-1 female to male ratio for gallbladder pathology. It's more common with women who've had children. It's also more common with people with a high cholesterol diet. So we see it in people with diabetes or metabolic syndrome, obesity, things like that. So those are usually our most risk populations. But then again, it can just be, you know, you pick the wrong parents. It could just be an inherited thing. Your mom had it out, your dad, whoever, and just passed that one on to you. So.
Right, many different risk factors there. Let's also talk a little bit about the innovation. So a lot of gallbladder removals are done laparoscopically, robotically. So tell me a little bit about the bikini line scar technique.
Yeah, so pretty much your gallbladder these days is taken out laparoscopically, which means 3 to 4 small incisions, usually about a centimeter or less. Robotic is just another kind of advanced tool for laparoscopy. And this bikini scar technique is 1 incision about a centimeter in size, hidden kind of in your umbilicus or your belly button, and then 3 kind of right at your waistband line. So if you were wearing a bathing suit, it would be hidden, those 3 incisions. So between 3 and 4 incisions like that, the one that would be somewhat visible is in the umbilicus, but I do my best to hide that, so when it heals, you won't even be able to tell.
I love that. Really innovative right there, and it's perfect. So let's also talk about who may be a candidate for the bikini scar technique.
Well, if somebody comes into me and they say, I'm really worried about these scars, I'll talk to them about it, absolutely. But typically it needs to be people with a little bit lower BMI or body mass index, just to be able to reach up there, because obviously it's a little bit more distance to get your gallbladder that's located way up high on the right side versus where those incisions are, which are kind of low. So got to have the right size torso, and usually people with a little bit smaller BMI. But plenty of my patients come in and they would qualify for it.
Right, and it can be very frightening, a little scary for some people. So what would you like people to know about gallbladder removal surgery?
Yeah, so it is scary, right? It's an operation. You got to go to sleep, all that. I get that. I will say, most common thing that I do, it's extremely safe. It usually takes me only 20 minutes to do the actual operation. You come in, you go home the same day. And typically, patients are back working in a week. I've had plenty of patients that ask to go back the next day, and I almost urge them just to take it easy. You know, give yourself some time. It's okay to take a week off of work, honestly. So I guess that's my thought I'd want to leave with people is, if it's bothering you, you have any issues, it's so safe, and you can return to your lifestyle very, very quickly. So it's something to consider.
Thank you so much, Dr. Schutter. Where can people find more information about everything you spoke about today?
Sure, you can go to our website, Premier Surgical, take a look there. We'll get some videos uploaded for that, and then you can call us. We're more than happy to talk it out, and I'm always accepting new patients, and yeah, so give us a call.
Thank you so much again, Dr. Schutter, for sitting down with us, talking about a new innovative way for a very routine surgery for many people. So thank you again for that. And for more information on all of this, you can find it all on livingeasttennessee.com. Thanks so much.